laserul medical pe bază de diodă. O să fiu foarte scurtă, că am foarte mari emoții. Și îl prezint pe Davide, care ne va prezenta cursul atât la nivel teoretic cât și practic. Sper să vă placă. Spor.
Thank you. Okay, this is educational courses resume the types of the technology that possible use in any case in dentist office. My name is Davide Bosco Lantoretti. I have been innovated and scientific disseminator in science 1989. I translated the search and research in didactical and in the courses. I collaboration with many universities in Italy and another country for the courses. I don't touch the patent, but I make the tutor in the case, the practical case. I'm an honorary member of the SNOI, Society National Odontology Italia, and CD, the Society for Hygienists in Italy, because in Italy the hygienists have a group of regulated to the law. I'm manager of the Creation Academy. Is a network platform that provides training of the use the creation products. About 5,000 of members in the world. The Creation Academy is all including the publication or relating to the use the protocols individual device. Translate in Romania, and this is built inside in the box of the laser. The educational, these are types, the first types of the courses. The second types, the scholarization, when you buy the laser, 1 day of the scholarization in your office for the theoretical part and the practical to the patent. Okay. And second time, possible attend the in-depth first types of the courses online for refresh the use the laser, because you understand that book have about 80 protocol inside. You don't remember the protocols, but possible refresh for different types of the family of protocol. The protocol is resumed in the family different for the periodontics, endodontics, surgical, biostimology, okay? And the in-depth one have constituted in the courses 1 hour about every 2 months for different types of the family. In-depth 2 types of the courses during about 1 or 2 days in the presence for specific use of the device. For example, educational have 245 slide. Scholarization so much long, about 570 slide. Another service is help desk service. You use the WhatsApp for information. You don't remember the protocols, they use the activity principle in any case. This is example, the types of the scholarization courses in the Palermo. Next week I tutor for the use of the laser with the patent. This is a service including the laser box. Okay, the sponsor is Creation, the branch, the mark of the NB Electronics. NB Electronics is a big company in Italy that produce for bigger name, okay, as a production facility constituting 2 walls where each product is designed, manufactured and certificated. Every in the company. This is the number of the company. And this is types of the produce the medical device that produce 4 types of the laser, intraoral welder for immediate loading, electroporation for aesthetics, and hazy root for extract the root, okay, the surgical use, and two devices that produce in joint ventures with the Korean society. Korean society produce the mechanical and B electronics, which the March creation produce the electronical. This is see you later. Okay, what is the laser? The light amplification stimulated emission of radiation, the photon. Okay, you think the photon, the light particle. The photons are packets of energy that have no mass but have like a mass when touch the obstacle and transform the cone in the heat. Wavelengths interest use 810 nanometer and 635 nanometers. This is not so much important because in commerce you have many types of wavelengths, but for odontology, so much important two types. This type, because the first type is the first line in the laser. The laser have two diodes inside. The first diode for the cutting by stimulation, the contamination. The second light for by stimulation, active precipitate active. The human ear see between the 400 nanometer and 700 nanometer between the rainbow before the UV ray, after the infrared ray. This is the wave ionism, is no good for the human. This is don't have ionizer, okay, the ray. The difference between online and the laser, online divergent line, multicolor line, non-coherent line. The laser is a collimator line. The particles go on together in the space, okay, convert line, and the photon travel one direction, and the monochromatics. Every surgeon, every surgeon have only one line. Some tissue about like only at the specific wavelength. The photon we are interested in the eye particularly attached to the brown and the blue ions. There's a chromophore concentrate the light energy in the trident side and promoting obstruction. So much important for the use the laser endogenous chromophore, hemoglobina and melanina. When this don't present, I use the exogenous chromophore. For example, povidone young, methylene blue, toluidine blue. But your attention that when the subject with glucose 6-phosphate absolutely cannot take methylene blue because a problem has been so the cause of hemolysis. In this case, use diode povidone. Is simple and don't worry. Okay, I don't recommend that they use the peroxide inside in the pocket when you use the laser. In many books in the university suggest these types of technology, but this is obsolete. Okay, the new search don't consider these types of technology. The tissue absorbed the laser transmission through the tissue to the laser, scattering divulgation inside the tissue, reflection. Reflection is much important for safety. You use the glasses safety when you use the laser. The glasses safety as certificate for only one lay. Okay. Don't use for every types of the laser. In these glasses, as the bright, the wavelength is safety. Okay. the 5 biological effects of the laser 810 nanometer: anti-inflammatory, physiological analgesia, hemostasis, decontamination by stimulation. Anti-inflammatory action, thank you to prostaglandine, cytokine, and interleukins. Okay, this is a photosensibilization of the types of wavelength. No for every wavelength, only for these types of wavelength. Physiological analgesis. Analgesia affect wavelength to diode radiation interact with the melanin cells of the Schwann cells, and the polarization, the nodi de Liouville, reduce the nociceptor. Hemostasis, laser produce hemostasis to the photocoagulation, thank you to absorption the energy for hemoglobin. The iron inside the hemoglobin release the oxygen, okay? The contamination for two effects, only affect physical, for the thermal action of the laser radiation allows the elimination of the pathogenic bacterial flora and disintegration of pathogenic macromolecules above 15 grade. The second effect, chemical and physical. The 810 nanometer laser activated the photosensibilizer that produced the single oxygen for the use the methylene blue or protoporphyrin. Biostimulation, this is important, they use the 635 nanometer red line, acts of proline, precursor of fibroblast, so much important for the collagen types 3. Biostimulation, the 810 nanometer, the second line, okay, interact with the mitochondria. When inside the mitochondria is born the ATP, adenosine triphosphate, the action, and the photosensibilization with the use the 810 nanometer. The precipitation in the production of the cellular tissue translate into change of the Allen times, reduce the Allen times. For example, if available on the operation called blade, the scalpel, in 10 or 12 days. If you use the laser, the same result about in 6 or 8 days. Okay, this is no choice for the market or the commercial, but this is the choice for the goal to the protocols. Okay, the first, the cooling system and design, the terminal type, fiber and handpiece, quantity and the quality of light, wave light, the types of the wave light and the source. A diode laser is a semiconductor p-n junction. The current causes the electron to migrate for the n region to the p region, and this process generates the emission, the pocket of the energy. Okay, migration the electron, the zone M and P, and this migration, generation of the pocket of the energy, that brought to the myron, okay, and the script only one types of the wavelength. Every source have only one types of wavelength. In this diode, have inside this two diode, because one source have one wavelength and second source have a second wavelength. Don't possible one source produce two wavelengths. Important for the cooling system, because the diode laser, the concept and the technical produced is so much small, but emitting so much cooling. Cold. Okay. The choice can make a difference between a positive result or the faulty protocol. For example, in this case, if you don't use a good system of the calling, the tubular, when closed for shock thermic, this is open. You think, but the laser don't function in this case. No, these types of the laser don't work. Okay, so much important the calling system. Another important difference is the handpiece. The laser which chosen must have a continuous fiber inside the handpiece. The fiber go on and put off the lay contact the cell. Okay, starting to the diode and go to the cell. Don't have interrupt. In this case, it's no good because I have two types with the interrupt, 1 and 2, and inside disperse the power. In this case, I use the high power because part of the power dispersed in the interrupt. In this case, I use the low power because the power current every distance don't have interrupt, don't have stop. This is caused the minor and major influence. The fluence is the quantity of the photon that touch the cell in only one instant. I have many photons, I have high fluence, and they use the low power. Different if you have low photon, you use the big power. It is not good because hotting the tissue reduce the perceivability of handling. The fourth element, the choice, the wavelength, the types of the wavelength. So much important, don't use 980 nanometer, the sign and produce. Okay, because these types of wavelength you look of in the commerce, but this is no good for the clinical use because exploding necrosis for the cells because of interaction for the water in the cells. Professor Scarpelli, in well-known the application the photodynamic therapy, recalled the use of the diode emit a deadline down the 830 nanometer. 880 nanometer is out. Okay, you use only the wavelength down. This is types of machine. I don't important much, but have these types of wavelength. It's not good for the use in odontology. Another example in the 1980 year, the para professor in the Your Blue book of pioneer of the use the laser 30 years later, the 880 nanometer so much stress, thermal stress. This is a good performance when you use two diodes for two wavelengths together. Don't like when you in the commerce you look off the one wavelength of diode and secondary line the LED. The LED don't have capacity to the biostimulation. Only this is good, is not good. Okay, the protocols. The protocols confident and repeatable for procedure. Don't man depends, but derived only the scientific paper. Cochrane, Madeline, Padman, Nutures. Okay, this is book. If there are these types of the paper, and the end of the book, you look off the link for research that use for the write this vote this library. The fundamental of laser management is 4. The time, how many times I stand by in this location. The power, how many power I use in this time. The focalizing have 2 conditions. Focalizing the stop in the one position, and when I move it, defocalizing, or when I retract defocalizing. Okay, focalizing, defocalizing, focalizing, defocalizing. Okay. or when change the diameter of the terminal. This is foculasis because little, this is defoculasis because this is big. Okay, they open the exit the photon. Okay. Activate and disactivate the fiber is the fourth element. When activate the fiber, when I want surgical ablation desensibilization. Disactivate the fiber when I want go to periodontics and odontics and biostimulation. What is activate the fiber? When I touch the articular paper and in the head of the fiber, the fixing the chromophore of the paper or articulation. Okay, the color is blocking in this, and every photon go to the color. Okay, in this case, emitting low radiation but so much hot. This is good for evaporation of the water in the cells. Okay, if you want biostimulation or decontamination, don't use the activate but disactivate. In this case, take the opposite instrument for cutting 2 millimeters. Okay, and open the facet of the light. The difference is the types of family of the protocols. I repeat, fiber activated, surgical, ablation, desensibilization. Fiber disactivated, cutting the head of the fiber, periodontology, endodontics, biostimulation. After the courses, when you look at the practical part, you activate the fiber for the cutting for the tissue. Okay. Okay, dentistry protocols, periodontics. Okay, every protocol derives the paper-centric paper. Let's see the phases. The first phases measure the pocket, okay. Second phases, the station to the starting. They use the glasses with the water and inside have vitamin C, okay. Another glasses with they use the iode. Use first vitamin C and second iode. Don't contrary, because the iode is soluble with the acid ascorbic. I think it's most important the chromophore, no soluble. Use this for irrigate and second for activate the photon. Okay. Attention when you use the, for example, DVC, because inside I have acid acetylsalicylic. In any case, the patent, if possible, are the allergic. In this case, you use only vitamin C. Iode. After they use the types of chromophore, you take the fiber disactivated for decontamination, put inside the pocket, go mesial, distal and mesial for 30 seconds, okay? Interproximal, you stand by, just second, and cleaning about every 10 seconds, because I don't want the blend for possible automatical activate the fiber, okay? In this case, I extract to the pocket and the cutting, okay, and finish the treatment. About over 30 seconds, cleaning the fiber and make the biostimulation about 1 minute. You remember the laser go over the gum, okay? And this biostimulation is so much important for developing the epithelial attack, okay, and the contamination again. This is example. Use water and vitamin C. Vitamin C is by stimulation the chemical, the prolina, substrated of the fibroblast. Povidone for attract the photon and go in the pocket. This is a courses I moved the action because I the tutor. Every video in this book, in this PowerPoint, I registered when I the tutor by stimulation. Okay, 2 minutes about for one pocket. If you have 4 pocket, 8 minutes. When I can consider the contamination, the source of the pocket, when the 3 classic symptoms of periodontal infection disappear, the pie when chewing, the bleeding, and inflammatory. I don't have bleeding, I think the contamination are successful. In this case, the protocols require 5 sessions, 1 for week. In the first 3 insert inside the fiber in the pocket. The 4th and the 5th don't inside the fiber because the cicatrization is on, and I risk the mechanical broken. Okay, in this case, the 4th and the 5th only by stimulation, external by stimulation. Don't put inside. Okay. If you have a pocket over the 7 millimeters, your possible choice, they use the technical no sky, closed sky, but open sky. In this case, the rexative surgical types of decontamination, the bore of the pocket. You think the bore is composed of the 2 macrofamily of the component, the mineral and the organics. These types of the laser don't have effect in the mineral, but have effect on the organics. The organics elements, it's 3, osteoblast, osteocyte, and osteoclast. The osteoclasts are the macrophage, okay? And the 18, the antigens. They produce the osteoclasts when I have many antigens. If you decontamination and the biostimulation, the mesenchymal cells, okay, the osteoblasts develop in the osteocyte when reduce the number of the osteoclasts, reduce the antigen, reduce the macrophage, okay? Okay, this is an example. The starting to the classic technique, the Feston prepare the clinical prepare. Okay, the bore use the drill, and the second time I biostimulation and decontamination the bore. Okay, disactivate the fiber, 1 watt the power. Okay, and use in the second time when I have the suture, use the suture because decontamination by stimulation the bore and the gone. Okay, the connective tissue after the suture. 1 watt for power, but because I use only 1 watt of the power, because I have high flowers, okay, many photons that touch the cells in one moment. Planted the paper. I have the fortune, the collaboration with the Professor Daniele De Santis, University of the Roma. This is the pioneer for the use of the laser in the periodontics. This is slide is a gift to me, the professor. I have 2 types of perimplanted. Only the color, reversible perimplanted, mucosit, only the mucus, okay, the starting the perimplanted. When the perimplanted go on, I have this problem of the blob. This is I have a fibroblast, blob, and the bacteria. In this case, second case, I use the surgical system. In this first case, the close and sky operation, the same, they use the technical for the contamination pocket, okay? I use the protocol inside the laser. I use the water with vitamin C, iodopovidone, and the laser to contact to the titanium, because this type of the laser don't have interaction with titanium. Don't disturb the titanium. Okay, 1 watt of the power, the cleaning the head of the fiber, 1 watt of the power and deactivated the fiber. Okay, I clean the fiber. If the fiber active automatically, I cutting the head of the fiber. When I stop the contamination, the cutting, because it's active, spontaneity, okay, I go to biostimulation, same the treatment of the pocket, okay. In this case, 1 minute of the biostimulation, 1 minute of the contamination, 2 minutes for the implant. And you review the patient 5 sessions, 1 week distance to the 1 session, second session. In this case, when the periimplantitis go on, you are reactivated, and the same the reactivated for the pocket. In this case, University of Verona use the blue dimethylene, okay, for match the zoom, histological types of system, and after use the laser deactivate the fiber 1 watt for 1 minute. When I close the lens by stimulation after the suturing, okay? If you review the patient, 4 sessions only for biostimulation after the surgical treatment. In any case, the surgical treatment for periimplantate, for frenulectomy, for papillom, you is good operating 4 sessions by stimulation after treatment for possibility of the healing. Surgery, general surgery. Why I use the laser and don't use the scalpel? Because scalpel, when cutting so much number of the cell and blooding. Why don't use the electrical bisturi or electrical cutting? Because electrical cutting, possible generation of the problem to the muscular tissue, okay, and the scar. In the laser, don't have a problem because evaporation only 4 cellular struct for passing, okay. It's so much conservative. Hemostasis, the effect activity use the laser with the power. In this case, the protocol of the surgical they activate the fiber. In the biostimulation and the contamination don't activate the fiber. In this family of protocol, activate the fiber and use the power little big, 1.5 watts. When you encounter the fibrous tissue, use 2 watts. Okay, the different the power is the types of the tissue I am emitting. Case of frenule, labial frenule. This is a condition after the surgical, no sticker, no bleeding, and the scarring by second tension. When you use the laser, the scarring, the healing, every for second tension. Don't use the stick. If necessary, surgical action continues, bearing in the interproximal eye to the papilla. The plan are to evaporate any fibrous tissue, because I want facility the orthodontics action. After 3 days, after 5 days, the heading is a go, you see the proline. Okay. This is example. Just I check. You cut two parallel incision, and after they open the diastema. Okay, you go to the file of the tissue, the zone of periostic, evaporate the cell for mobility, and second time use the gel for hyaluronic, for don't contact the tissue at cutting. Okay, and I consider this for the use, the house use these types of treatment of the gel hyaluronic in the night. The lingual phenolic for pathological condition to rehabilitation. These types of procedure is not very different from the labial referendum producer, except to anatomical issues that may arise the fall of the tube. And any different, it's the encounter the sublingual vessel. Okay. In this case, you stand by in the position and stop the bleeding. Okay. In this case, you use the gel for anesthetics done infiltrated because the patent is very strong. Two vertical incision, and after they open the diastema, cleaning the fiber for the frustum. Okay, and go on. About 5 minutes these types of treatment, but don't stick, don't tissue suture, don't bleeding, don't inflammatory, don't pain after the treatment. Use the gel for protection of the zoom, and reuse the gel onward, about for 1 week. Intrapeducular fibroma, position yourself at a 55 degree angle of the clinical cleavage plane and inches the premium of the fibrotic. If they go wrong to the fibrotics with the head of the fiber, in this case I have the fiber active with the blue paper, and take the fibrotic, go to the run to the fibrotic and extract the fibrotic. Okay, if you want possible analysis to histologic. This condition, this position is very dangerous for the patient because the position of the buccinator muscle, it's possible gamming in this. If you have the stick, the suture, but if you use laser, don't have as chance of use the stick or the suture. A police is the same for the clinical treatment, no for the prostitution. This is a condition after the extract the epulit, about 8 days for the healing. You remember the biostimulation every visit of the patient. In this case, the surgery is similar to fibroids. In this case, sealing the low power, about 1 watt, because I want to preserve the sensory of capacity of the organ. These cells is so much important, use the low power because I want to preserve the sensory of the organ, the linge. Preparation of the, in this case, I don't use a retraction cord, but I position the laser perpendicular to cleft and parallel to the stone, okay? For the allergy, the condition for the use the framework. If you're the patient in this condition, in the normal case, I recommend to your house for 7 days and use the chlorhexidine. In this case, I have the laser, I in instant resolve the problem, activate the fiber, 1 watt of the power, and run to the abutment and ready to improve. Don't have problem the recession of the gum. Another types of the cases of the surgical is use the nifedipine. This is a starting condition and the finish condition, about 20 minutes for these types of the surgical intervention. This case have the brush with the laser tip activate the fiber, and the brush in the zone don't contact only 1 millimeter to the zone. Okay, they evaporate the tissue, to preserve the tissue, don't have problem the blade and the stick. The cleaning the fiber when you use, this is a principle. The tutor, I consider to reduce the launch of the fiber. In this case, the possible regulation of the fiber of this is good because don't vascular when you touch the tissue, okay? And the cleaning the tissue. This is condition after the treatment. Don't bleeding, don't stick, don't inflammation, don't bite after the treatment. Operculectomy. You remember that these types of the laser don't have interaction with the titanium. I activate the fiber and go around when the abutment regions, okay, and put off the tissue, start to use the abutment. Canine inclusion. The procedure is similar to the previous one, operculum. In this case, to the laser is very conservative, does not damage the tooth, and we were able to the place to bracket in the same session because there was no bleeding. Let's now look to particular case. Okay, in this case are very short the guarigion times. Okay, this is in 3 days. This is secretis, the guarigion times. But so much important, the combination use the laser, the first waveguide 810 and 635 together for biostimulation, reduce the times of the LD. This is another example. They use the lidocaine gel. About 5 minutes, these types of treatment. Operculum for search the canine. Okay. They open the operculum. They cleaning the fiber. Adhesive, so much adhesive. And position the bracket in only one session. Position and the traction of the bracket. The stop, the treatment. Don't have the blending, don't have the sticker. Precancerous. I discussed this topic at recent Snowy conference, which lasted almost 2 hours. I will summarize in a few slides for don't have many times, okay? But you have the idea that possible use the laser in the precancerous dysplasia occasion, okay, for pathological oral, have 3 types of the treatment. The first treatment might use the 19%, 80% occasion. The second in the 5-7% cases in this for 1-2 cases. Okay, 3 different of approach to the cases. Leukoplakia in the buccinator zoom. Okay, in this case we pick the flap with the tweezer and with the laser fiber cut the position observed of the 45-degree angle and the fiber tissue leukoplakia, okay, for extract the tissue of leukoplakia. The power 1 watt and half and the fiber active. We recommended the biostimulation with the fiber that active 1 watt after the treatment surgical, okay. And this condition after 8 days to the surgical, okay, because I have biostimulation with 2 with light. Lichen, in this case the tissue is not fibrotic, it's a soft tissue. It is possible brush with the fiber, okay. Starting condition and finish condition. The power the same, but don't use the cutting. This is condition after the treatment. When you visit the patient, remember the biostimulation. This example, brushing the zoom to the lichen. For evaporation only the superficial cells. No bleeding, no stick, no suture. About 5 minutes of treatment. You remember, don't have tissue, not have suture, not a stick. Only for visit by stimulation. If you want to use the gel, the hyaluronic acid for cover the zoom, the surgical zoom for 1 or 2 days. This is so much preciso to millimeter condition on the surgical. We type this laser. The solution of the use the photodynamic therapy, another type of solution, the rare solution, 1 or 2 cases in 1 year. Okay, when I have extensive and on-liver lesion, mixed anatomical zoom, the patient use the anticoagulant, possibly problem the patient the hemolysis hemophily or immunocapacity. In specific case, use these types of protocols. I use the laser, 5 amino acid, acid aminolevulinic, okay, or another types, the same aminolevulinic, methyl aminolevulinic. Okay. In this case, the development in protoporphyrin name. So much important the acid developing protoporphyrin for development. I have necessary about 2 hours to oxidative the acid in the zoom. After, when transformer in protoporphyrin name, I biostimulation with a laser. The protoporphyrin name is organic fried molecular tetrahedral that make up skeleton of Ame. Ame is the same to hemoglobina. Okay, I have the iron inside, and last when I use the laser, the oxygen singlet for degradation of the molecular. In the tumor precancerous cells, this process is defective, allowing the accumulation of the protoporphyrin. If defective function of protoporphyrin name in precancerous cells allows us the explosion to the moleculars interaction with photodynamic therapy. It's selective only 1 types of the cell. In this case, protoporphyrin is good for precancerous cell, not the normal cell. Okay, normal cell don't engage with the protoporphyrin. The process only possible if you use two diodes, because I have two times of the reaction. The superfluous relation when you use the 635 nanometers, profundity reaction when you use the 810 nanometer. But important they use the types of the power for have the goal, the protocols. The 810 nanometers use 1.5 watt. In the case of the red line, 635 nanometers, 100 milliwatts. If you use the laser with the LED red, is not have power. Okay, in this case, don't action of the protoporphyrin. Another type of the technical that use the laser is a rock in Italy, ricostruzione ossea combinata, in English combinate bone reconstruction. Okay, the acronym don't say. The Professor Lancieri, the University of Genoa, creator of the rock technical. The rock technical, following the professor Guido after the surgical preparing the seat, the bone seat, with the maxi or the beta types calcium produce and tissue of colifibrin together. Okay, the mixture the soul have the consistent. The professor called wet side, the types of the condition, the types of the particle. With the stimulation and the contaminated with are the 810 nanometer diode laser and the pre-regenerative mixture. The fiber is the 400 micromillimeter disactivated fiber with the power 1 watt and the time 1 minute for square centimeter. The biostimulation, the calcio trifosfato and colifibrina. Thanks to the use of the laser, the calcium triphosphate are created with the incubator for the organics portion. And you remember when by stimulation the organics portion of the bone, the osteoblast develop osteocyte. Okay, the same result. But in this case, using TCL and calcio triphosphate because I have done damage to the bone. Okay, protocol of endodontics. Oh, you remember the most important for this protocol, you have the stability of the power, okay, the cooling system of the laser. Starting, you first ask the patient of the quantity of the sensation, the pain, when we'll use the scale for to tell visual analogic scale, VAS. The second step, we'll use the hydrogen peroxide to change the pH of the dentinal tubule. The cause open the tubule, okay, change the pH, open the tubule. The patient will be cooperative. I know anesthetic because I need to know how the pain session has changed and of the procedure. In this case, use the peroxide, open the tubule, and second time use the gel. I think Durafat because of the high number of the percentile of the calcium, okay, about 5%, but possible use reduce the percent, 3%, 4%, don't down the 3%, okay, over the 3%. I have opened the tubule and put on the gel with the calcium. The calcium go inside the tubule, activate the fiber, but use the low power, 0.3 watt, 0.3 watt, no 3 watt, 0.3 watt. Okay, a little circle in the zoom because when I use these types of the power with the fiber activated, evaporation the water to the gel, okay, and the broken the ligand to the gel and the floor inside the tubule, evaporate the gel, and closing the tuber. Okay. Very important, for 10 minutes after the procedure, the patient should not rise, drink, or spit, or remain still. Okay, for 10 minutes, don't move the patient. This is ensure the tubulars are closed and they could recoup due to the thermal shock. If you make the thermal shock, the tuber is open. Okay, still the patient. This is condition the starting, the condition of the finish after the 10 minutes. This procedure does not work on calcified or atrophic dentine. The dentine are mobile for have its effect. They use the water oxygen, the gel, in the every zone interested. Activate the fiber, the low power, 0.3 watts, a little circle for evaporation the water, okay? Soft contact, okay? About 40 seconds and standby 10 minutes. Finished. Start prove the patient the bass, the pain sensation of the patient. Or directed pulpit capping. In this case, I cannot be done because the tooth is rotten, and the pulpectomy in this case necessary pulpectomy. Okay. In this case, possible pulpectomy, not pulpectomy, because I have recently the damage. Okay. In this case, the pulp is soft but pale. The mange is recent. Can try performing pulpectomy and preserving the cavity. Activate the fiber and apply 0.8 watt, okay, low power. So see the pulp, the clean, the change the color, okay, it's whitening the color in the strong the contact. In this case, possible directed pulp capping. If the color don't change and the pulp is soft, is no good, I pulpectomy. Okay. In this case, possible tentative for don't pulpectomy, but only pulpectomy. Treatment, the root canal. This is a coriaceous, soft, difficult breaking these types of material. But if you use the laser, the possible damage this material. They use the technical of corkscrew, okay? You go inside, regulation and the launch of the fiber, with saying the launch to the canal. Go inside, stop laser. In the put the pedal and the helical movement, okay, or the apical to coronal apical. Don't touch the bottom to the rod, okay. The first treatment with the channel with inside the peroxy, and second and third treatment the dry channel, okay. About 20 seconds for treatment. Free treatment in only one session. In this case, it's possible to use the fiber of the 200 millimeters. In the box of the laser, have two fiber. One fiber 400 millimeters, micromillimeters. A second fiber 200 micromillimeters. This is fiber used for endodontics and fistula. In this fiber used for cutting the contamination by stimulation. This is example for retracted the treatment. manual treatment. The first treatment with the channel with the rod inside. This is slowly movement. Apical, coronary, coronary, apical, return about 20 seconds. And repeat for 3 treatment on 1 session. And after you close and finish. If you want possible biostimulation, the zoom at treatment. You visit the patient about after 1 week, biostimulation, a control for the radiology condition. I possibly use the laser when apicectomy. As well know, apicectomy involves 2 fundamental steps: removal of the apex of the several bachelli, infected root, followed the decontamination of seat and filling of the anatomic area. After mechanical decontamination, a laser can be used to decontaminate biostimulation and surgical area and to dissolve the gluteperca. I possibly use the laser same to a plug for dissolving the gluteperca. Abscess. In case of abscess, we must first understand a primary cause. Next, we can work directly over abscess, then evaporate this surgically. In this case, use 1 watt and half, and energy and the fiber, the 400 micromillimeter, activate the fiber, and the contamination the zoom. In this case, use the fiber, the 200 micromillimeter, and the contamination, the fistula, put inside, and put the pedal, and the contamination every lunge of the fistula. So much important biostimulation after the surgical treatment, review the patient about 1 week, and the contamination and the analysis of clinical condition. Biostimulation. This is the 3rd treatment the possible use for the hygienist. The hygienist possible use the laser for the contamination pocket, biostimulation, desensitization, bleaching. This laser have a password dedicated for only hygienists. When you use the biostimulation protocol, possible to use together the terminal, use the low power or big power, half watt, 1 watt. Okay, the difference is, okay. When you use the biostimulation, every movement, don't stand by, every movement, no focalization, the energy. Example of combined laser protocols for the single dental technique and the post-surgical. This is conditioned to the starting the post-extraction socket. The biostimulation make the fire effect of the laser, hemostasis, decontamination, antiphlogistic, analgesic, and biostimulation effect. This is described in an article of University of La Sapienza, Roma, where you have tried these types of the protocol for the 50 patient. 25 use the laser, 25 for extraction don't use the laser. The difference so much important in this article is you see the different the precision of the holding. A case of chemio-induced mucosite, in case of contact or during induced the mucosite, such as the chemotherapy induced, the mucosite biostimulation session can be performed to prove the resolution of a lesion with a few hours. A typical complete holding of threat are occurs 48 hours after the procedure. Osteonecrosis is the particular types of the treatment because so much dangerous use the laser for the surgical. In this case, only for biostimulation. Little surgical about 1 or 2 cellular aspects, and after review the patient about 10 weeks, one treatment or week of biostimulation for reproduce the tissue. Okay, but so much soft the surgical part, initial practical surgical part is so much short. With biostimulation, we can also treat cancer source, whether the larger of the small. We use 2 different protocols, one for ablation and one for biostimulation. If you have a small after, using only biostimulation, okay, 1 minute about 2 watts. If you have a big after, use little surgical, okay. Active the fiber. The longe fiber is small because I don't want vascularly of the movement. Active the fiber, 1 watt, and evaporate the superficial cells, okay, every the perimeter of the after, and after you biostimulation, review the patent about 2 days, the control, the biostimulation, but I think the after is stopped, okay. Herpes labialis, this case several types of labialis herpes. Biostimulation, if don't have bleeding. If you have bleeding, active the fiber because make the escalate. Okay. If you don't have bleeding, don't important this. But if you have bleeding, active the fiber, 1 watt the power, and a little circular for 1 minute in the zone. It's a condition at 8 days. Bleaching, the 4 protocol that possible use the hygienist. Don't have the laser that bleaching, but the peroxide. The laser is a catalyst for the peroxide. Okay, it's much important the quality of the peroxide. A possible use peroxide and peroxide carbamide. The different, the carbamide have a long time, about the debut time. Okay, if you use the laser and the peroxide after the action, the peroxide about standby 10 minutes. If you use carbamide, about standby 20 minutes. The protocol involves reading each tooth individually with the focalizer, the laser beam, use these types of hand piece, okay, for 30 seconds. After they apply the laser, let's the hydrogen peroxide act for the duration recommended the manufacturer, about 10 minutes, okay? If necessary, repeat the operation of the single element or party of it. The protocol involves irradiation of each the individual, the focalizer lives 30 seconds. Okay, the example. $30 for element, for you want worker for 4 elements, 2 minutes, okay? Little road about the possible contact in this case because a new types of pills. The length is a protector, this distanciator, this contact is not possible because the distanciator is possible next to the gel, don't have problem in this case. This is a types of the gel, and so much important is the color. The gel have a color, blue or the brown. Okay, don't white or don't have color. Okay, don't use these types of handpiece because no collimated light is no good for the laser. This is good for the LED. For the laser, this is don't good because make the ombrage in the any zone of the mode. It's possible when you use the biostimulation, you have the question, but it's possible to damage the cells? No, because if you use the good types of the laser 810 nanometer and you use only 1 watt, okay, don't damage because the energy in surplus put off the cell and spare the colors. Okay, I have finished to the protocols of the odontology. In small times, I tools the used in dermatology, aesthetics, medicine, arteriovenous, and physiotherapy. Dermatology. Possible use for wards. Okay, in this case, I activate the fiber and go to the worms and evaporate the tissue. The second time possible biostimulation and check about after 1 week. Chelite, same, I activate the head of the fiber and evaporating the tissue, make the escara, and when escara go down, they finish the chelite, and the biostimulation after treatment. Exanthel asthma, it's a particular types of the treatment because in the zoom dungeons next to the A, okay? This is the treatment. You cover the age. This is use iodopovidone. The cover a zoom. In this case, use the air. Okay. Don't use the lidocaine. Don't use the infiltrative anesthetics. Melanocytic nevi, in this case, it need the control of histologic. The total border of lesion vaporizes the with finger in contact, use the fast standing movement to minimize the stress and the time. Peduncular fibroid, similar in intraoral. They can vaporize the lower edge of the lesion, use the active fiber, 400 micromillimeter fiber, in contact with the tissue. Okay, extract around to the fibro. And after the brushing the zone for completed work. Papules, it's a possible evaporation of these types of the aesthetical problem. Necrosis is the same treatment above. Folliculitis have 2 times the several acne and after the several. In this case, the contamination zone, these types of handpiece, about 2 watt or 3 watt, the high power, don't contact, little circle, and use the air, okay? In this case, is a surgical resurfacing, okay? Check the little zoom for the first action, and check this about after 1 week, is the good the condition, repeat, okay? And the biostimulation after the surgical treatment. Vitiligo, psoriasis is a difficult goal, the treatment, but it's possible, okay? If you, after the 5 sessions don't have a good result, stop it. If you have a good result, continues for 10 or 20 sessions for the treatment. Keratosis is the same. Lentivo is operated with activated fiber, use the slow power. Okay. Slow power, don't use the power over the half watt. Okay. If you use these types of the power is good because don't make a hypochromy. Okay. You're starting to hyperchromy. If you don't use the good power, possible make the hypochromy. Important, you cover the zoom after the treatment for 1 week and the biostimulation after 1 week. Scar recondition. Recondition use an ablative technique and is suitable for permitted post-operative of fibrotic scars, not depression. Okay. Laser don't apport tissue, but evaporation of the tissue. Use a conservative power starting at 1 watt and increase as the need of active fiber. This example, diode polydome for decontamination zoom, activate the fiber, I for cooling, and when I change the color, I stop the treatment. And after biostimulation, I review the patient about 1 week in biostimulation and 1 week at biostimulation for 4 sessions. The biostimulation is good for result, the goal. Don't expose to the sun, okay? If you want, it's possible use the gel for cover. Not necessarily, but possible. Aesthetic medicine. And my book presents 6 aesthetic medicine protocols related to the photoregeneration. They use an active ingredient and frame without. Possible use with active ingredient or not. Have a 3 level to the photorejuvenation, normal skin, young skin, and mature skin. Okay. Biological dynamics on organic tissues. Some damage due to not pathological overexposition the sun. The damage caused by overexposure to the sun is necessarily pathological, no necessarily pathological, but I can't still be the very annoying, unexpanded aesthetic piercing. They use the laser, the benefit, the fiber revitalization collagen, elastin recondition, reversing the major effect UV ray, and cellular biostimulation for regeneration. The treatment will activate the ingredient involved spray cleaning the tissue, followed by the application in the layer of cerium. Use hyaluronic cerium if you want. Use the types of the hand pierce. The difference for the protocol, the 3 types of protocol, only the power, the time is the same, but if you use to younger skin, use about half watt. For mature skin, normal skin, use 1 watt. For mature skin, 1 watt and half. But the time is the same, about 20 minutes for the face. Okay, and this is the PS. This is example. Hyaluronic acid don't infiltrative on superficial. And biostimulation for vascular, superficial vascular, augment so much the movement, the blonde vascular. The different of the treatment is re-entry the zone, the cells. The barcode is expanding. We move the handpiece over the hyaluronic acid gel, which will help it glide smoothly across the maze. We use the small circular motion over the treatment, about 1 minute for square centimeter, about 20 minutes for every face. With this condition to the starting, deshydrated condition the skin, and the hydrated condition the skin. During the treatment about for 6 months, okay? The 5 session, 1 week from the session, and after you refresh the pattern about every 6 months. Okay? If you want all refresh or repeated the treatment. Possible use the laser together with the filler. Okay, in this case, the laser, radiated laser biostimulation helps minimize the patient discomfort during the infiltration and afterward reduce the swelling and the risk of localized infection and the personalization, reduce the gonfios. Okay, arteriovenous. In this case, I have 6 treatments of arteriovenous hemangioma flat, hemangioma cuneiform, different approaches. The flat use the low power, the cuneiform the big power. Okay, the possible use for telangiectasia for the face and the leg, different approach. Okay, only these cost about 2 hours of the courses. In this case, I assume for little times. Possible use for rosacea. In this case, only use the biostimulation for coagulation from the blooding. Okay. A possible use for the spider, little spider in the décolleté. Okay. For example, starting and change the color of the hemangioma. I have finished the work because in consecutive day, the macrophage eating the bleeding remaining in the zone. Don't touch in this case. Okay. Transform of the red in the white. And I finish the treatment. Biostimulation, I check about 7 days or 10 days, and hemangioma is stopped. This is telangiectasia, is a treatment. You have many patterns because one types of the treatment launch about 1 hour. So much difficult. You use the eye, don't use the injector. Physiotherapy. Okay. Physiotherapy, the treatment is 20, but it's the same because every treatment has the problem of the inflammatory, scar predictability, and the pain. Okay. The laser don't know the names of the protocol, but the only function. If you have a problem, periarthrite or herpes condylite, the same for the laser. Okay. The names only for the convention. In this case, I use the low power because don't have so much tissue, okay? And by stimulation intrinsic zoom, intrinsic point, and processing to the intrinsic zoom, about 1 watt or 1 watt and a half, depending on the diameter of the and pills. In this case, 1.5 is sufficiently. Okay, about 5 minutes in the Zoom and 5 sessions, one session for the week. This is another types of the protocols for the problem to the fracture, the bone, the plantar, periarthrite, arthrite, stone, various types, the plica, synovial, various types of the problem with you and the types of the protocol. You see the pattern about 1 week, or use the power for 1 watt and half or 2 watt and half, okay? 5 or 6 sessions finish the treatment. This is a certificate recommendation for the use the protocol, the random, the user for profundity of the problem, the pain. We use 1 minute they use, 1 minute the pause, 1 minute they use, 1 minute the pause for 5 action. They change the power for profundity. Okay, safety. In this moment, in Romania, don't have a law for the safety. In Italy, for example, is a law for the definition of the laser safety officer. But so much important that for nomination safety laser officer, you have a text added, okay, but don't only this. It's important that you have the copy of the course syllabus, okay. Also, the attached specifically the safety was discussed, and the copy of the answer the questions for the safety. You have 2 types of the document for nomination the safety officer in your job. At this point, the question arises spontaneously. How much does it cost? We can return the use the laser in technology. The answer depends on the technology, the schooling, and the training received. For example, you have the same number of the seat, number of the patent, number of the collaboration. The difference, if you use the laser or don't use the laser, is the 20%. If you transfer is a cent in one here. If you use the laser, the difference with the laser becomes under 20. So the efficient and effective with laser technology, you need to the schooling, the training continues, and the good technology. If you use the wrong laser, don't take the courses, the instrument become the quick catch. Okay, it's beautiful to see, but don't use it. Okay, it's not good because I have a wavelength 880 nanometer, and the Chinese produce. The different to investment on the cost. If you want every only cost, buy this. If you want investment, buy this. Okay. Okay, I stopped. I speak the laser in 5 or 10 slides. I speak another types of technology only for curiosity. Okay, these types of technology is electroporation. The same the engine aesthetics. Okay, but the technology is so much different. This is laser produce the light. This is electroporator. Electroporator produce only the electrical impulse and only for aesthetical use. Okay, medicine aesthetical. We have a presentation in Dubai about 1 month later. The exposition, the IDEC. I am this. Okay. The electroporation transdermic medical aesthetics, low voltage electrical impulse open the aqueous channel. The names is electropores. Non-invasive, depth controller, painless, reversible effect. No use the filler. Okay. Electroporation allows the transport the products to pass to statum corneal or down the statum corneal and the cell membrane, converting the active ingredient inside. Use the hyaluronic acid. Okay, the history, but so much important. This is starting in the 2003. Dr. Aguinon's discovery water in China is the Private Nobel for this discovery. Okay, I knew this technology because I already attended my first university courses in 2007. The Private Nobel are in 2003, I had the first courses in 2007, University of Italia, of Scala. And the electronics present ABC, electroporation, beauty care, and advanced aesthetics medicine system combined to technology and specialized cosmetics. These cosmetics are studied only for use in types of device. All active ingredients have been designed for electroactive use at the common base of hyaluronic acid alone for effective and safety transdermal passage. We have three types of the protocol and three types of the produce. Okay, the base is hyaluronic acid, but when you use it in a normal or young skin, use types different of hyaluronic dimension. When you use the medium skin, use hyaluronic polyvitamins and mineral salt. Okay. And when you use the mature skin, use the hyaluronic biomimetic peptides, particular types of technologies in medicine aesthetics. This is an example. It's so much simplification the use of the massage on the zoom when you use the possible use types, same types of the don't use this only for laser. This is erected also. Okay. This is a condition, the first after the treatment. The difference significantly reduce the deep glabellary, reduce wear plates and the ears, and the flaking of nasolabial. The different, this and this. Only for information, the possible use these types of the treatment for the body if you use hyaluronic acid and phosphatidylcholine, this degradation the molecular to the flat cell. This is different to ionophoresis because ionophoresis, system polarization, ionization cosmetics, cathode and anode, transmission of the currents in your body. If you use the electroporation only on one situ, or only in the face. Different, they use the electroporation and radiofrequency. Radiofrequency broken the filament of the cell. Possible combination use the laser and the electroporation. After they use the electroporation, use the laser for the utilization the gel hyaluronic acid. Before and after is a good treatment. 5 sessions, okay? If you want to review the patient about 6 months for refresh. After, before. Okay, the possible state-art instrument made in Italy, cosmetic solution, training, enable use the technology, a creation open day. In this case, so much simplify or use these types of technology. A possible create open day for the studios, for the advertising for the patient. and have the informative material. Use the technology possible communicated to your patent for the use of the odonto marketing system to connect the clinical technologies to marketing strategies to attract a new patent in dentistry and aesthetic medicine. Use the 4P, the marketing, product, price, place, promotion. The product, the laser electroporation as an extension of the offer. Interrogative aesthetics and dermatology and dental treatments. The advanced technologies, they are a symbol of innovation, safety, premium studio placement. The price strategy, definition of the price consistent with the technology, the skills of the party and the target, at the combo packed to dentistry and aesthetics. The place where to provide to service the dental price as a multidisciplinary center interaction with the dermatology and aesthetic medicine of the face. The patient's education and information social media, open day, information courses or the informative clinical content. The attracting the new patient through the aesthetics needs entering into the practical network or loyalty. The transition will be for a dental praise of wellness network. The cross-selling sanitary over the dental purpose, the dermatological purpose. Okay. We use these types of tools for communication with your patient. If you buy the laser or the electroporator, using studios the banner for view the patent, the types of the treatment, the flyer, so much important, the videos of clinical geolocalization. It's possible make the geolocalization. This is in Italy, okay, but when the patents research in web, I have a problem with parodontics, I have a problem with surgical, and see these types of the video and the possible following the indication for a platform when possible use your position and make the dumping sanitary, okay? Okay, this is the social and when I make the courses. Okay, I have finished the theoretical part.